all you guys are from the UK and the US, I understand.
No, a lot of people are from India have joined in. At least half of
Oh,
them are from India here right now. But yeah,
oh, okay, okay. So then I think it's my job to
yeah.
encourage you all to
Please
join.
introduce yourself. So we will, yeah.
Um, I'm Dr. Sheila Nambiar. I'm an OBGYN, and I live in Ooty. I have a hospital here. I also include, fitness, diet, all of that, all the pillars of lifestyle into my practice. But my primary, when I started out, it was mainly fitness and diet. So I do have a fitness center also. I've been practicing lifestyle medicine, or what is actually now lifestyle medicine, for like over 2 decades. I kind of went into each aspect on my own: positive psychology, CBT, fitness, diet, not realizing, and then only came to realize it was a whole field by itself as late as 2018, when the first Asian conference of lifestyle medicine happened in Taiwan. So, and then we had Manila the following year. And now we have started the Indian Society of Lifestyle Medicine, and some of you are members. So, what I would like to say is it would be really wonderful if more Indians join the Indian Society of Lifestyle Medicine so we can take this movement forward. Because, from both ends, both from educating and helping the physicians understand what lifestyle medicine is about. Not everybody understands what it is, because this whole concept of lifestyle specialist is rampant in India. Everybody is a lifestyle specialist. So to kind of make people understand this is an evidence-based allopathic field of medicine, etc., we need more physicians like you on board. So I'm hoping that I'm the current president. I've just taken over as the president of ISLM. So I'd really encourage you all to join ISLM so we can join forces and take this forward, not just for the physicians, but I think from the other end of the spectrum for the lay public as well. Because what I am noticing is that more and more patients are asking for not alternative ways, but they are also asking to be helped to take health into their own hands. And so I think it's our duty to give them the right tools, because lots of people are giving them lots of tools. There are people advising them on diet, there are people advising them on exercise, and it's all random and it comes from all kinds of perspectives. So since ours is evidence based, I think we really need to also be able to give them the right tools and help them along to prevent non-communicable diseases, etc. So please do consider joining ISLM. We're having our conference this coming year, and because now we are a sister concern of IBLM, that is the International Board of Lifestyle Medicine, and LMGA, the Lifestyle Medicine Global Alliance, ISLM can hold the exam, the international exam in India. And if you live in India, you will essentially have to take it through ISLM. So do consider joining us and help. This would be like the early stages of the organization, and I'd love for you all to be a part of it. Thank you so much, and thank you, Anita, for allowing me to say a few words. I'm going to probably stop the video, and I'll be here as long as I can, but I may need to take leave.
Yeah. Thank you.
Thank you. If you have any doubts, just reach out to me about ISLM, and Regina also. She's also, and now Anita's also joined. So you can reach out to me regarding ISLM.
Yeah. Thank you so much, Sheila.
Thank
You did a wonderful job for the introduction. So yeah, I just joined the ISLM too. So if there anyone here are Indian physicians here in US, please do join, because membership always helps. So thank you so much, Sheila.
Thank you.
So I will just go ahead and do the quick presentation, and then we'll leave more time for questions. So Sheila already just mentioned about what lifestyle medicine is. It's basically what we have been doing separately, like in some do physical activity, stress management, everything is there, especially in our Indian medicine. I mean, we have been doing forever, but right now this is like just evidence based. And then, okay, so they formed this American College of Lifestyle Medicine, I think in 2000. I forgot what year it is, but 3 years ago they started giving these exams. So mainly, it's they want to end chronic disease in simple words. That's it. So that's the main purpose of lifestyle medicine. And the main difference between this and all naturopathy is, this is like Dr. Sheila already mentioned, it's evidence based. Everything, like we have to follow the guidelines. If a person comes to you, so they are assured that you are doing you're following up with their regular medical stuff and only offering them evidence based guidelines. Sometimes there are no evidence based, but there are some we still try to help the patients, but that's like we have to mention that it's not evidence based. So that's the main reason why if we certify, we know what is evidence based and what the other stuff is. So who all can join? It's not just the MD. It's other nurse practitioners, registered nurse pharmacists, registered dietitians, and just advocates. There are a lot of people, like other different PhDs if you have done, they can join too. And this health coach is another which all these people can become health coach too. I'm planning to do that also. So today we'll be covering both MD and health coach. Mainly, health coach is for people like especially in US, if someone doesn't want have different specialties like anesthesia or radiologists, who are not actually practicing primary care, it will help them to do, and even the other physicians also. So we'll be covering these two today. So it's mainly to educate, empower. There are a lot of CMEs, ACLM. ACLM is American College of Lifestyle Medicine. So they're always trying to keep us updated. And main thing is like, to spread the word also. So what is lifestyle medicine? It's again, just going to say, it's like, we go on telling it's evidence-based. That's all it is. And the rest of the things are the same, physical activity. And then we address the root cause of the disease. So that is the thing. In conventional medicine, we are always treating the end result, whatever happened. But here we are trying to focus on the root cause. So you'll be hearing this very frequently, 6 pillars of lifestyle medicine. That's the same for all the diseases. This is the base and the foundation, which we try to address at every patient's visit. So this is nutrition. You must have already heard. It's predominantly whole plant-based foods. So, I mean, if people are eating non-vegetarian, people just get scared and they don't even come when they hear about plant-based. There's so much we can help them. It's like they can continue to eat what they're eating, but we have to focus on what to add. So that's what we need to, that's what we try to do, like fiber filled, nutrient dense and all that. And sleep is so important, which even I never realized before. So like even one night of, if you don't sleep well, next morning your blood sugars are high, so I mean, patients, I actually tell them to check, to see, and then they realize how important it is. So I mean, it's not just for diabetes, for a lot of stuff. It helps us to prevent Alzheimer's, prevention, or like someone in the family has Alzheimer's, that sleep is very important. I mean, for prevention. And so many in every aspect, like I said. And exercise, we already know how much it helps in everything. I was shocked, like in stroke, like, physical active, post-stroke, physical activity actually is much better than medication. So, and we have substance abuse, we know tobacco and alcohol. Stress management is another new, I mean, it's not new, but then how important it is. We would hesitate to talk about this to the patients, but now, we just tell them to sign up for meditation classes, or, there's so many in whatever they like, it doesn't matter. Whichever form they do, it all helps. And then healthy relationship is another one, which we wouldn't mention, but now we have seen, especially group classes, even for treatment, the group courses actually help them more than individual. And also, so like I said, the same 6 pillars we use it like for to boost immunity right now for the COVID situation, so what can we do for the patients? So it's the same thing, stress. If there is stress, increased cortisol, and that, suppresses the immunity, sleep suppresses immunity, all that connectivity will help, like positive emotions and all that will improve immunity, and activity we already know it helps. And then no smoking. So it's the same 6 pillars, we use it for every patient. So why is it so important? I mean, it was always been important, but right now the chronic disease is like really rampant. So that's one. We know how diabetes is also, going out of, too many people. India is actually the number 1 in the diabetic deaths. So, India being a vegetarian country, predominantly vegetarian, why is it? It's mainly because of our, food habits, too much oil, less activity, all that stuff. So, and also money. Money is another thing. Like 90% is spent on chronic disease, so we can save money instead of treating them, having more multi-specialty hospitals. We should be doing this, And right now, with the current situation, with the COVID, we already have seen how much all these diet and lifestyle influence all these diseases, and how person with all these diseases, if they get COVID, how it's impacting, we already know. So ACLM is what helps us to, get more, learn about this evidence-based and help our population. So ACLM, it has 5,000 members now, but I think all over the world. So that's why we hardly know about this. So, but it's like increasing 50% every year, 50% growth rate.
Started in 2000. It is something new.
Yeah. Yes. It's been there, but yeah. But the exam started just 3 years ago, so that's why it's now people are getting aware. So we'll talk more about these things, how to go each. You can just do the course, but you can do the exam or just attend conferences. So certification is what, I would recommend every person to do. I'm the person who doesn't like to take exams, and then, do the, I don't know, I haven't given an exam in like 25 years, but I love every minute of it, studying. 3 years ago, I knew about the exam, but I thought like, oh, I'll just study. I don't need to give an exam. I don't need a certificate. So, but then, last 3 months, I've been doing this for a few years, but last 3 months I learned so much, and now I know how much more is there to learn. So I would recommend everyone to do the exam. So first thing is, today basically I'm talking about the exam because most of you already know about lifestyle medicine. So first thing is you have to become a member of the ACLM or ISLM. ACLM is American College of Lifestyle Medicine, and then Indian Society of Lifestyle Medicine is the Indian one. One thing is you have to become a member for so many reasons. There's so many resources available, lots of videos, materials, especially for patients. You can give, we don't have to start from scratch everything. Everything is there and we can use it. Like these slides which I presented to you also, I pulled out from their, you know, resource. So we don't have to keep doing it. This is one slide I made. So second thing, another reason why you should become a member is like you get discounts on all these things, like if you're a member. So if you don't go ahead, don't go and buy a course first, because with the membership you have 10% or something discount. But always ask someone who has already done, because the website, it's very confusing. It's not like an Amazon where you just go and buy something. Here, I mean, I spent hours figuring out how to do. So that's why I think Sirish has posted a link. We are having a Facebook group just for the Indian members. So I'll post everything there. So, and you can also ask questions. And yeah, second thing is you need to do a 30-hour credit. I mean, like a course. So there are, you need to buy a course. It's available on ACLM. So there are two options. One is board review and the other one is called core competencies. If we have time, I will log in and show how they look. So board review is sort of like a guide. So for exam, it's very good, but to read, sometimes it's like very dry. It's but for exam, it's that's what I read, most of it, and most of them do that because it's very it looks like they also give a book. I mean, you know, and then you have online access also. So that's how much you need to read. I mean, there's a lot of information, but yeah. Core competencies is more like a lecture based. It's very nice to, you know, understand and all that. Also in the board review, there are 6 videos also are included. So board review is enough, but if you want, I mean, you can, but there's another Facebook group too. I will with all over the world, people are there. So I will put that link also. So people usually, some of them have core competencies, some have board review. So people form small groups and they have exchanged with each other. So yeah, just buy one and whichever you are comfortable. If you like to have a book, because core competencies doesn't come with a book, you have to make your own notes. But in the Facebook group, all the questions from the board review are already in the file section. And the core competency questions, I have all in an email. So I'll send it to everyone. I think a lot of people have. So for questions, I'm sure you can always get it. And yeah. Then the third thing is you have to register for an exam. So this year it was all, I mean, we could do it anywhere. We could do it at home, but normally it's, you have to attend a conference, live conference, and there was an exam after that. So I don't know how it will be next year. So probably it's the same thing, yeah. And then there's one case study we have to do. This case study could just be you can do it on yourself also, or any family member. It's very easy to do. They are not looking for complete reversal. It's just a little bit whatever you could help. So yeah. So these are the 5 steps. I'll go over it again one by one also. So first, becoming a member, like I said, mainly to get the discounts also. I mean, not mainly, but I want you to do that first before buying anything, because there are discounts also. And then there are a lot of webinars, monthly webinars they keep doing, and it's all there on the, you can access them and watch the old ones. Then second one, okay, this is the website for the Indian one, lifestylemedicine.india.org. So this ISLM registration is new this year, I think. I mean, so just figure out, I mean, we have to, I mean, I talked to Sheila, she did say like, you can get this discounts by joining ISLM. So either join the ACLM or ISLM. So one of the two, and then you'll get the discounts. And for this is the ACLM. For the ACLM, the website is lifestylemedicine.org. So this is how it looks. So they have all these monthly webinars, resources, all this stuff. So the second one, which I was telling about the course, this is one board review course, which comes with this book. And they also have online access, so you can share with others. And this is, yeah. So I just wanted to mention the cost. Normally it is $899, but with the member price is $675. So this one. And the core competency program is a little expensive, $100 more, $799. So this is the first cost. For the membership, it's $100. I've written, yeah, 100 I think for ACLM, and for India ISLM it's around 3,000 2,000 something rupees for membership. Then this is the other core competencies. So when you're going to buy, it shows like, you know, two of the same, one with CME and the other one without CME. We always need one CME, so make sure you buy the right one. And also for core competencies, they give all, they even sell separately each chapter, because some people just buy they'll buy this and then the nutrition. So make sure you buy the whole core competencies if you're buying it. Then, okay, so there is another website called ablm.co. So this is American Board of Lifestyle Medicine. So American College is different from American Board. We were also very confused. So this is the place where you go to register for the exam. So it won't be on the other one. All these slides, I will save them. I mean, hopefully the video too. So you don't, and post it on the Facebook. So this you need to know later when you're, right now you just need ACLM and ISLM, but this is where you register for the exam and upload all your certificates. Okay, so the cost, for the exam is standard pricing for US people is $1,000 with the rebate, $1,649. But for Indians, and I think I know some of you have joined from Dubai, you have different pricing. It comes up to like $1,200 or something like that. But for other thing, for US people also, I've seen in the other group, they made, and like 50 of them joined together. Like, I mean, that's why it's important to join the group. So you can join in like 2 months. You don't have to register for the exam now. You can join like, 2 months before the exam date. So 50 of them joined together, like, and then they got the same price, like a discounted price. So don't be in a hurry to join. So we can make a group, and we can also get the discount. Okay, so yeah, this is the group I was talking. It's a lifestyle medicine board study. A lot of people are there in this from all over the world, and you can ask questions. There are in the file section, there are a lot of resources there. All the questions are there. So many, you can go in and join that. But this one I just made now yesterday. So if we put the link in the chat, you can join in. So this one will only be for the Indians from India and US. So we can help each other, because some things are a little bit different for the Indians or someone who's giving from Dubai. I think there are a few. So please do join. Okay, so so the other one is the in-person CME, is the conference which everyone has to attend, but because of the COVID situation, we did it online. So I don't know how it will be next year. So you can attend the ACLM conference, and there are other approved CMEs also. So there's a list. So you can do those. So how much it costs, I've just tried to do it approximately. So first ACLM member is $100 and for the ISLM is 3,000 rupees. And the course will be $675 or $799. To register the exam, this is the whole regular full price. And then attending a conference depends. Everything for the from the ISLM they have discount if you do, but that's you should be from India or Dubai, those not from the US. And then a case study. So these are the 5 steps to get if you need a registry to get a board certified certificate. Okay, so I just wanted to mention this is Rajina's from Bangalore. It's their site. So there are a few people from I think from Ayurveda or homeopathic doctors also who have joined, and also for someone other specialities. I just wanted to know there is a different thing like coaching. That's what, even though we are getting this LICE American College of board certification, we are basically trying to coach the patient how to do, because they have to do all the work. We are just guiding. So that's something new which I didn't know, and that's what everyone is doing. And this is one Invest on Health by Rajina, and then in Canada, Gift of Health, Dr. Shobha and Arjun Raipudis, they're doing. You can check their websites to see. So this is a new field, like new option for you guys to do. So you can do your medicine, like someone has you're a ER physician or a radiologist, anesthesia, you can learn about it and you can do this. So my dear friend Sirisha is actually doing the health coach, health coach program. So she will join. She will tell. So go ahead, Sirisha. So let me.
Hi, Anita.
Okay. Okay, can see you. Yeah, you go ahead. I'll spotlight you soon. I don't know where you are.
Hi. Hello, everyone. I think most of you already know me. It's very good to see the familiar faces, and thank you, Anita, for doing this. This is really good. Everyone can learn how to do the boards and everything. So this is, as Anita said, like we know, like what is the reason for all these chronic diseases. We know the science. We know, like, we need to eat more fiber, we need to exercise, we need to reduce stress, we need to get rid of the visceral fat, we need to get into the metabolic resilience, and all that. But how do we do it, right? So for that reason, we are doing the health coaching. That's the reason I joined the Well Coaches. Well Coaches is recognized by American College of Lifestyle Medicine. So once I get certified from the Well Coaches, hopefully in January, so I can practice like a lifestyle medicine coach. So how to do that? So next slide, please, Anita. Yeah. So as I said, lifestyle medicine for coaches is a 18-hour online course. But in order to do the lifestyle medicine for coaches, you need to become a health coach first. For that reason, we have like various, coaching schools, but Well Coaches has very comprehensive and, good program where they have like 4 modules. First, in the module 1, 2, and 3, first of all, you'll become a certified coach. And from there, you will do, in module 4, you will do a health coach. You will become a certified health coach. So in order to become a certified health coach, you need to complete module 1, 2, and 3, and then you'll get there. So I'm at module 4. So hopefully I'll soon get certified like a lifestyle medicine coach. So Well Coaches is the one that's recognized by American College of Lifestyle Medicine. That's the reason I chose that. So there are many coaching schools. Um, um, I'm not sure in India how it works, the coaching, but the lifestyle medicine coach certification that you get from Well Coaches can be practiced around the world. That's what I came to know. So it works even in India. Next one, please. Yeah, so here it talks about why we need to do like a lifestyle medicine coach. Like there is a pathologist, an ophthalmologist, or a dermatologist who don't regularly see the patients like a primary care provider, right? But they want to, they're interested in doing the coaching, or they're interested in helping with chronic diseases in their patients, right? So for that reason, you can become a lifestyle coach. Even a primary care physician can become a lifestyle coach. Like so many times we get patients where they have normal BMI, their labs look good, but they have a lot of visceral fat. What to do with that, right? So there are things which you may not be able to help in a regular practice, but then as a coach, you have more time and dedicated one-on-one interaction, and then if you become a coach, you can be referred by other doctors to help patients as well. So there are like, corporate world, which is hiring the Well Coaches, hiring the lifestyle medicine coaches, and then, all these places you can help. And I will, as Anita said, we will be sharing all these slides as well as the recording, where you can, see how the lifestyle medicine coaching program works. And if you have any doubts, you can reach out to me anytime. And my personal interest is diabetes, because, next slide, please. Yeah, because this is again, the Susan Benigas, the ACLM executive director, talking about, lifestyle medicine trained health coaches, how they have been helping in both clinical and worksite settings. Next one, please. So as I was talking, like my passion is in helping with diabetes. So while I am learning more about lifestyle medicine and following all these amazing doctors and, following in my own life, how I lost weight like 7 years back, and how I was able to keep it up and sustain it. And all this knowledge helped me help my family, my dad, reverse his diabetes. So that became my passion. And we already did like 2 online plant-based workshops where we were able to help, you know, someone who's trying to lose weight, someone who's trying to reverse diabetes and all that. So going into lifestyle coaching can, help us to help patients and participants in reversing their chronic diseases. So I think like this is going to be very helpful for someone who wants to be in the medical field, who wants to help, but not in the primary care, or who are in the non-clinical side of medicine. They can hop on to that, and these are the plant-based doctors to follow. And you all know, like, I'm passionate about creating the recipes which are plant-based, which can help reverse disease. So we all know the science. We know to reduce the stress, eat more fiber, exercise, but many people are clueless on how to do it, right? How to do it on a day-to-day basis, like, because the everyday stresses are not unavoidable, they're inevitable. So how to deal with that? So all this can be learned in the lifestyle medicine, as well as when you get certified as a lifestyle medicine coach. So I just wanted to put out there that there is a option like that, and I'm doing it. And thank you so much, Anita, for this opportunity, and
Oh,
thank you everyone for joining.
Thank you, Sirisha. So, yeah, that was really good. Yeah, I'm also planning, hopefully in future, to do the coaching. But anyone who is still deciding whether to, I mean, before you buy any books or anything, just follow all these doctors and every, I mean, you can go on their website. So much information is there. Each one is, like I know Sirisha just like found Dr. Michael Greger, and that's it. She's a big fan. I mean, we even stalked him to take a picture once, like on the parking lot. Yeah, if you go on nutritionfacts.org and put any question you have, he has tons of resources and everything is free. So that's where I would first want you to go. And then for me, it was Dr. Neil Barnard, pcrm.org. That's the first website I had found, and that's what I've been using in my patients for a few years. I get all the information from there. They have a lot of resources. And then, of course, Esselstyn, Joel Fuhrman, Dean Ornish is our idol. So like for prostate cancer, he's the one like for meditation, mindfulness, all those, like he has evidence-based research in all that stuff. And then for Alzheimer's and all that is Dr. Tim Shersai. They're neurologists. They're doing wonderful work for Alzheimer's reversal and all that. So you can follow these. I mean, every day, like me and Sirisha, we are always sharing new stuff because I know what she knows and what we don't, and so these doctors always share anything new which comes up. So that's how we are up to date. Okay, and these are like few I mean, websites and questions. If you have, you can always contact. One thing, like in the ACLM membership, there's only one person, like he's the only one who's answering all the questions. So sometimes if you, I mean, he's very good. If you don't get any answers, sometimes they're standard ones, please ask other people what it is. I mean, because if you're not finding the right answer, we ask again and ask someone else. So post it in the Facebook groups. Thank you.
Anita,
Yes.
yeah, this is Dr. Mundra. I joined late actually, so I don't know what the initial part, whether you have already told. I'm a gynecologist. I am in Dubai. So now my children, they are in US. So as such, I'm planning that maybe I may go to US and stay with them. So with our Indian degree, I cannot practice my gynae in US without doing USMLE. And I'm too far ahead in age to do the USMLE now. So if I'm doing this course, say, so can I practice there in US? This is my question.
If you
like
have,
after doing this.
Yeah, if you have, I mean, the work permit, yeah, you can do as a health coach. That's why we mentioned the health coach, but you need to have a work permit, right? Yeah.
Okay, so
Work
that
permit
work
is like the
permit,
green
I
card.
think if your children are citizen, I think you do get work permit. Or
Children, I mean, then if they apply for citizenship for you, I mean, they'll apply for green card for you. Then when you get your green card, you can work. Yeah. If they're applying for green card, usually they do most of them.
Yeah.
If
Right,
they're applying, once you get the green card, then you can do. Yeah.
So once we get this certification, then we can practice there in US, right?
The health coach, not the lifestyle medicine exam, but that one is to get your knowledge. But you need to get the health. That's the second part which we showed you, the health coach. With that, you can practice, not with your, not with the lifestyle.
Yeah, so you told us about the 4 modules, right? You told us about the 4 modules.
That part. Yeah, that
And
was
the 4th
I think,
module.
Anita, I think Dr. Seema is talking about the certified lifestyle medicine
Yes.
coach, right?
Yeah, coach, yes.
Yeah. Yes.
So basically, like say, if I give the exam, which you're talking about the 4 modules.
Yes, yeah.
So if I clear the say 4 modules, then I get the certification, and with that certification, I become eligible for practicing there.
Yeah, practicing as a lifestyle medicine coach. You cannot practice the OBGYN in
That I know.
yeah. So you
That
can
is the reason, because I cannot practice that, to keep myself in touch with something related with
Medicine.
medicine.
Yeah, that would be great. Actually, you can finish all the 4 modules and then become certified as a health coach, and then become certified as a lifestyle medicine coach, and then you can practice as a coach.
And so practice as a coach. So why do you do this? Is not an individual. You join some hospital, they permit you, or what is the?
Yeah, so many hospitals are hiring coaches. There are corporate places that are like people who individually practice as a health coach, like an independent health coach. And there are people who work under corporate as a health coach. There are hospitals and doctors who are hiring health coaches, because as you know, no matter how much we talk about health and all that, weight loss is $1 billion industry. And it's not like, okay, there are like on Instagram, you see like lose 20 pounds in 1 month. And there are crash courses and all that. But what about the long term? What after you lose weight? How do you sustain? All this is what we learn in the lifestyle medicine coaching. And that's the reason now more hospitals and corporate systems are hiring.
How is the salary? How is the salary structure? Any idea? Like when they are hiring, say, any idea? I mean, just
You can message me. Yeah, you can message me anytime.
I mean, since before planning anything, I mean, we should have a complete picture about.
Yeah, because it varies from,
Yeah, that is what I'm asking. Rough idea. I mean, at
It's
least one
pretty
should
good though. It's pretty good. Actually, Dr. Regina is there. She will talk next. She's doing that from India. She has clients she's from Bangalore. She has clients all over the world. So yeah, she will talk after few people. So yeah. I know Maitri has a question. I'll just, we have 2 more people to just talk a little bit. And then Maitri, you want to go ahead and ask your question?
Yeah, hi. I was recently introduced to this. I'm a physician. I'm a nuclear medicine physician, mainly into cancer diagnostics and treatment. I trained and I was practicing in the US, Los Angeles, California, for about back to India about 10 years ago. And being into cancer treatment and diagnostics for the past few years, I was very inspired into organic gardening and healthy. Not been totally vegan, but the effort has started. And this seems very interesting. I trained and did my residency in the US about 20 years ago. So at that time, I was board eligible, but there was the requirements changed. I never got certified at that time. But I'm licensed in California. My licenses are still up to date and stuff. So I am not sure what is the right choice for me. Should I pursue the certified ACLM or the board certification? From what I saw on the web page, requires you to already be certified, right? Is that correct?
Tell you, Maitri, I'm the perfect person. That's why I actually started it. I have, I mean, I'm in US practicing, but I'm not board certified for different reasons because I did a different.
Maybe we can, if you can just message me, Anita, on WhatsApp.
No, I will tell. That's why it's important for everyone also. Like there are few who have done medicine in India, but they're not here. So, the thing is, it's the same exam for everyone. That's why I said if you question, send a question to that website, he'll just give you a standard one and we'll think, oh, you're not eligible.
So what is that website you're talking about? On which
you can give the same exam. Only thing is you'll get a certificate called International Board of Lifestyle Medicine. Instead of ACLM, you'll get IBLM certified. IBLM. That's what it is. Instead of ABLM, you'll get IBLM. And there's no difference right now with any certificate. only in US, if you're ABLM, maybe in future you might get more paid during the, I mean, right now you're not getting any extra pay with that board certification. So it's
But
the same thing.
ICLM can practice in the US. With ICLM, can you?
IPLM, I mean, no,
I
but
think-
you do have other, you need your other medical license, right? You have
Yeah, I do.
California license. Yeah, I have
Right.
California license. So
Okay, with that
I
I
think
can.
you can
Okay.
just practice and you can just add it as lifestyle.
Okay.
So someone,
So-
by chance, you don't have California license, but you have, you know, like you can, you have permit to work and you have medical background or anything. That's why you can do a health coach and you can work as a health coach with a health coach hat, not as a physician hat. So even though we are physicians here, they recommend us to have a health coach hat and do a separate thing. Don't, I mean, they have to follow with their cardiologist, they have to follow with whoever they are doing. And then
Uh-huh.
you are just a health coach. So you specify, we are just helping you.
Okay.
You still have to follow. Yeah, you can perfectly do it. You can work for, I mean, here now with the virtual, you can work from anywhere in the world. And, you know, and that's the other advantage with health coach. Like for me, with the California medical license, now, even if I want to be a health coach, I have to see only people from California, and I can see
Right.
people from India because I have Indian license. But
Okay.
if I want to someone from I mean New York once, then if I have a health coach, that's why Sirisha decided to do the health coach. So then you the liability issue, you don't have that liability issue. Then you're just a health coach for them, and you can see anyone from there.
You are under supervision.
Yeah.
Okay. Even the long distance, so the malpractice insurance, all that applies for a health coach as well?
Okay, that's why you can, like for me, what they said, because I have California medical, I mean, so I have physician insurance for California. So I can be a health coach, but I have to see only from California people. Then I don't need an extra another insurance. But like Sirisha will have a health coach only. She can see all over because she's getting the license. Like I can see anyone from, as a health coach also, I cannot see anyone from New York right now. But I mean, my license, my insurance doesn't cover that. So
So
yeah.
if I am here in India, can I see patients in California with my California license?
As a
Or
health
I have to-
coach, you don't need a California license. See, Rajina will talk
Okay.
next. Rajina
Okay.
she has only Indian license. You
Okay.
can just use your Indian license and see all over the world. She has clients
Okay.
all over, so she will talk in few minutes.
Okay.
Yeah.
So how many months program is this, like say this to pass these 4
Four.
modules? This is like
4 or 5 months. 4 or 5 months.
total 4 to 5
Okay.
months. So
Yeah.
you can clear the 4 exams, 4
Yeah.
modules.
Yeah. So I think I have Geeta. Geeta, let me, will talk. Hi Geeta. Geeta is my dear friend. We have been like studying together from, unmute yourself, Geeta.
Yeah, hi. So I have known Anita for many years, and we have been together through med school, and we did our board exams together here in the US recently. So my experience has been I practice internal medicine and obesity medicine. So lifestyle counseling coaching really helps me. I technically do not get paid anything extra at the moment. Lifestyle medicine is just a new and developing branch. So it's how you promote yourselves. If you're in private practice, like Anita said, the coaching, the counseling, all those things can eventually get built. But I think most of all, it is important that if we are teaching our patients, besides the Western medicine, our family members ask us, what do we eat? What don't we eat? We know bits and pieces, but to give them evidence-based advice, lifestyle medicine really helped. Learning about sleep, learning about nutrition. These are things we know, but we are not sure what is the right thing. That's where um, getting the training gives you some expertise, gives you some expert value. And then the certification, of course, helps if you're promoting your business, your practice, wherever in the world you are. For physicians, you can use this as an extra advantage to your practice. But for coaching, you will need separate time. At least in the US, you don't get enough time to coach when you are a physician. One of the things with lifestyle medicine is we do not stop medications that their doctors have started for the patients till they see their diabetes is under control, their cholesterol is under control, and then we let the doctors, we work closely with their primary doctors and cardiologists. So the goal is not to stop the medicine, tell that just start eating and forget your cholesterol or blood pressure medicine. That's something we want to make very clear to the patients. So that way it's very helpful. Um, any other questions I can answer or help you with?
Okay. So maybe,
Yeah.
yeah, go ahead.
Yeah, a quick question. As a health coach, this is something as an ancillary care, right? You would get referred, the physicians would refer them to you, and this would something happen on an outpatient basis. And
Right now, I do not see a lot of referrals as a health coach. Again, I'm certified as a lifestyle medicine physician, and health
okay.
coaching becomes a whole different field. So you are in a little bit of a mixed territory. If you're a physician trying to do coaching, then you'll have to plan your day. Are you doing coaching on the side as private practice? Are you doing it as part of your, medical clinic? How are you going to accommodate the time? In the US, the billing codes are very different for coaching and physician. So you might have to first sort that out if you're planning to use coaching. For a physician, the billing and coaching is considered counseling. It is only a very small part of the reimbursement right now in the
Right. Okay.
healthcare
Okay.
system. Some of the others might be able to add on to this.
Can I
Yeah.
just, hi, can I just say something here? Hi, I'm Sharmili. I'm Anita and Geeta's classmate from KMC.
Hi, Sharmila.
I'm a licensed physician in New York and just wanted to add, I work for a health system called Northwell here. And we just started a new initiative with Whole Foods where they actually pay us to see the people who work for Whole Foods schedule appointments with us. They require us to see them for 45 minutes to an hour. And they have, I don't know the details about payment, but that's one avenue of revenue that could be pursued. Work with these big companies who are looking to reduce their cost for health insurance for their employees. And they want us to do a lot of lifestyle medicine. They want us, kind of tell us that we should not prescribe as much as possible, work more on the lifestyle piece. And they have health coaches who are not physicians who work with us. We're going to start in January, so I may have a little more detail then. Payment-wise, because we are salaried by the health system, they don't give us details about actual payments, but that's a big revenue way of doing this, working with some big companies, corporates who want to hire physicians to work with their employees so they pay less for health insurance. Sorry, Geeta. Just wanted to add.
No, that was great. That's news to me, and that's really good news.
Yeah. Regina, can you add on? Regina is doing this before even lifestyle. Can you unmute yourself? Yeah. Before, yeah, she is doing from India. I mean, she is an expert. Like they're doing, I mean, exactly like if you want to follow her, that's her, the one I posted earlier. Go ahead, Regina.
Yeah, I don't think I have any PPT to share, but I can definitely share the, brief about how we do this actually. I got into this because my husband was diagnosed with multiple metabolic conditions at the age of 31. And we took a journey to reverse the disease by acquiring knowledge from different resources. Actually, that time, I got into AHS, this thing, China Public School Health, then Fox Overnight, multiple things actually. Then actually gathered the information, and that time he was working for Philips Healthcare, so they were also getting into something similar pattern, in US. So then we got a lot of research, 2 years of research, and kind of 8 to 10 months of lifestyle transformation, we kind of reversed his condition actually, except for one surgery for a kidney stone and some panic attack. We had to take some medications. Rest of all medications were off by 8 months. That's how we got kind of completely carried away with the lifestyle medicine principles. And then actually my husband, that time working for Philips Research, he resigned his job. He thought it's something really something meaningful to the world we could do. And we came up with some kind of, we wanted to do some kind of artificial intelligence modulated the suggestion systems for eating and things like that. But none of these things work out the way we kind of envisioned, because the kind of data imaging on those kind of things were not that advanced that time. It was in 2014, 15 and all. It was not very advanced. So we kind of shifted all those. And right now we have only a platform, backend platform, where we have our doctors, 3-4 doctors, 3 doctors are there, 2 nutritionists is there. And there are some collaborators like physical fitness. We have collaborated with another group that I will tell you how the model works. And that over the last 3 years, it's successfully running. We do have clients all across the globe because of the online platform. But it's not something, scaled to a level which has gone really like 5,000 numbers. It's still in 400 to 500 number of people at a time in the system. We have already catered to 2,000 plus, but at a time we have about 300 to 400 people. So we have like different models, like 4 months premium program, 6 months or 1 year. So during that time frame, what we do is normally we kind of assess a person. We do have physicians in our system. We have 2 other lifestyle physicians too. So we normally have a interaction with them either through our Zoom or any other platform, and understand their medical history, and we kind of assess all their lab parameters. And there is a huge lifestyle assessment either done by a nutritionist or one of our lifestyle physicians themselves actually. So that includes how often they travel, what do they eat, how do they cook, how much oil they use, a lot of those things, whatever is written in our book. So after that, actually, we have something called a motivational interview right now done by a coach, corporate coach. We hired him because, that moment in time, that disparity match, people want to take up that transformation, but they're not ready to forego a lot of things. They just still want to have the weekly ice creams or alcohol and multiple things actually. So that is something that person's help, that interview helps actually. After that, we have a coaching by our lifestyle physicians, either me or one of us. And that is like, it goes around 45 minutes to an hour, normally done through 4 or Zoom again, because Zoom is much more helpful because we can also share PPT or PDF with them. I can also share some of these generic things in one of the groups actually, so that would be useful for a lot of them, a lot of you. So, and after that, we normally have something called a measure monitor feedback system. Each person is given with an app that the people register on the app. They have to put whatever they are eating. After the coaching, they have to put whatever they are eating and whatever exercise they are doing on the app. It's unlike MFP and all, MyFitnessPal and all. We ask them to kind of upload their meal images so that our nutritionist will look into the meal and give a feedback. It's real time. I don't say it's real time, but it's within 2 hours they get feedback. So they keep correcting those meal mistakes actually. So, we see around 4 to 6 weeks, people normally able to do a lot of changes, 80% of the changes. And, just like a book, what it says or the research says, cholesterol, especially LDL, we can kind of bring it down 30% by 1 month. Normally 3 months, 180 and all come back to 100, 100. And pre-diabetes, again, for 3 to 4 months, we can bring it down. And, other conditions, some of the conditions may require a longer term, especially if the obesity level is very high. Also, people have their own, challenges when you take up lifestyle transformation. It's not very easy. The environment around them is not very conducive. So they'll have to fight against all odds to remain in the thing. So that is what the system helps. System helps them to remain on track by constant motivation, feedback, and things like that. But what I feel is actually like 20 to 30% of them females especially having a lot of other challenges, relationship challenges, psychological, emotional challenges and all. So in due course of time, we understood that it's not just about giving some coaching. So it's a lot to do with the behavioral adaptation, which requires a psychological intervention. So now we have a psychologist who is actually, again, she's a PhD from Canada. She's taking care of people who are having psychological challenges, actually, basically with the BPDs, depression, seasonal affective disorders, those kind of things. Why? Because it was an online platform, it was easy for us to kind of cater to the people from outside the world. Actually, UK, we have US, we have Canada, we have all, 10 clients, 15 clients, or those kind of, even we have Canada, that Romania also we have clients, Ireland, Sweden, multiple places, but it's not in large numbers. So this is how it works. But I feel, as Dr. Geeta mentioned, though I knew a lot about lifestyle medicine, the research is going on in this field, I kept on reading. Even now I read at least 2 hours, 3 hours a day to know what's happening, because it's a relatively new field. But the book and the kind of environment which the ISLM gave a different perspective. Every time I could kind of evolve the model. And also, like, after the exam is over, I could also refine the cholesterol lowering model to do with whatever researches we have learned in the books. These are some of the things which helps with taking up the membership and taking up the exam. Once you take up the membership, you will become a part of one of those groups. There are a lot of discussions are going on. Those discussions itself help, and also the kind of like exams help to fine tune your knowledge to how to manage a condition. These are the few kind of things which helps. And I feel that like, you don't have to have a app or a model and things like that to help people. You can start integrating these practices into your daily life, like where like when you're a person with a high cholesterol or obesity with some other conditions comes to you, you can always start kind of giving a prescription to them, have 15 minutes spent with them to how to change that. In case actually, like, you feel that you need a feedback system, you can always hire somebody to kind of give an ongoing motivational thing. You can always collaborate with your nutritionist, so that find a nutritionist so that they can kind of in touch with the person for at least the next 2 weeks. Normally it's the 2 to 3 weeks is what people face huge difficulty challenges in adapting to a whole food plant based diet. Actually, even now, if you can allow me screen sharing, I'll show the back end of the system. You can see some of the plates. Not every plate comes up, but at least 40, 50 people every day, or up to 80 people every day put the meal image. Okay, I don't know whether I can share. I can share. Yeah. So you can see everybody does. They will not go out of these things completely. You can see one of the meals. This is actually basically a Kerala based one. This is some kind of wheat puttu and fruit and flaxseed powder smoothie, and this is kadale curry. Kadale curry means chana, black chana. This thing. But if you see her lunch, she's an arthritis patient. We kept telling her to go off even fish, because fish also she grills it and have it. Still, she's not ready to go. I mean, from where she was, she has come a long way, and she's not on any medication. She's completely out of she's in remission right now. You can see a lot of them will not completely go off their non-veg stuff, but you can see 80% improvement, or some cases 30% of the people go off, but you can see a lot of them including nuts and seeds in their diet. Actually, like you can see this lady is 77-year-old. Can you believe it? She's putting her meal plate. She actually joined us when she was in the US. It was referred by PCRM, I think, or one of those people actually. And she was on 3 medications for hypertension. She's on only one. That also she wants to cut down now, because BP is regularized, and her walking became better, her mood became better. We also give psychological counseling, especially with women like this kind of background. So you can see a lot of changes. And the system also allows, if I see a person's details, let me check actually. So you can see this person's particular details. This is kind of body composition. The assessment includes a body composition assessment, and wellness score is something which we normally ask about their lifestyle and all. This person hasn't attended. The clinical profile, you can see all the clinical history. We can see every aspect of that person will be there actually. So, you don't have to go somewhere else to get the details. So this same information will be also shared with people, consultants, physicians who are working with us to get a second opinion. For example, somebody is on an arthritis drug or a hypertension drug. We always take a second opinion with the physician, whether we can reduce it once it is like consistently lower for a longer time. So investigations also can upload and comment, all the details will be there. That's how the system works, but not necessarily, you don't need this kind of a system to really, practice lifestyle medicine. You can always have some kind of a regular feedback system. That is must. I totally in for it, because people have a lot of challenges outside. They need constant motivation and feedback to stay on track. Is there anything
Thank you,
you want me to
Regina. That was like really, really helpful. Yeah.
Thank you.
Oh,
Running.
excellent talk, Regina.
Yeah. Even we really need it, So especially if you have family in India and all that, like I'm always trying to refer, to
Yes,
Regina, and then even Sharon India is there,
yes,
so trying to-
excellent. She's awesome.
They also do online, it's a lot of things. So please help your family members, it's very helpful. Even there are different levels, whatever level you can join. That's what our coaching help to just assess where they are, what they want, and then we do. Dr. Aruna is there. She is like doing in US. She's doing amazing. Our idol here in the ISLM group, one of our idols. So can you please share, Dr. Aruna, Nathan?
Hi, Anita and Shirisha. You guys are amazing to put this together. I just wanted to say that it's like anything else in life. This is just like a journey, and many of us, when we practice medicine, we would have felt kind of incomplete with our knowledge, or even with what we impart to the patients. We may have lack of time in sharing everything about food and about nutrition. I think ACLM or lifestyle medicine is a good place to start. It complements every aspect of medicine. So when you start with that, you feel a little more confident to give evidence-based recommendations to your patients, like Anita said. So it could be for sleep, it could be for stress management, it could be nutrition, it could be physical activity, also for things like alcohol and smoking and other addictions. And then you can also apply that to a lot to yourself, right? Because all of us, we hear right now in medicine, a lot of burnout, right? I don't know if that's if a lot of us do go through that, or some stages of that. So it really so it's a journey. So for me, when I started with lifestyle medicine, I felt like, wow, I found my home, right? Because there are people who think similarly. And then when I went for my first conference, I was overwhelmed. And then I certified the first year they offered certification. So 2017 is when I certified. And then initially I incorporated things like group visits. I think we really need to emphasize group visits when we talk of lifestyle medicine, because so much is accomplished in a group visit. Because we are trying to, when we see patients, say every 15 minutes or 20 minutes, you're going from one room to the other, you kind of catch yourself saying the same thing over and over again. Say you're talking about cholesterol, you're mainly talking about, foods high in fiber. And then you kind of keep repeating yourself. And at some point you might feel, oh my God, I'm saying the same thing. And you might lose that passion. Whereas for the patient, they're hearing it for the first time, because they're different patients. So it's not fair for the fifth patient to have less of your passion compared to the first patient of the day, right? So for many reasons, the group visit model works really well. So we did that initially when I started with lifestyle medicine. You also partner with life coaches, because they can help fortify what you're doing together in the practice, and then and with therapists. But so it's a process. So you will learn as you go. Like Regina said, how she modified the cholesterol algorithm. So we keep learning through this, and you go deeper and deeper into it. So you do your ACLM, then you see what you like, and then you might then add on well coaches, or because that's a great way of learning more about coaching. Because when initially when I did lifestyle medicine, I thought I had to download all the information on my patients every one I saw them, and I felt I got more burnt out initially. And then after learning about coaching and understanding changes or the stages of change, then okay, what, the patient is just ready to receive this kind of information at this point, and then you just concentrate on that. And it also helps you kind of conserve that energy through the day. So it's not just helping the patient, it also is so much centered around how you lead your life and how you practice. So I'm just extremely fortunate to be part of this group with Anita and Shirisha. I think, it has really literally made a life-changing, it's really life-changing. It really affects me and also affects my family and my patients. So I just wanted to share that with everyone. Thanks.
Thank you so much. Can you please share about your clinic or your practice,
Sure.
please? Thank you.
Sure. So I'm sorry, there's so much sunlight on me. So I'm happy to do a presentation, because I did the model through through taking insurance all the way to concierge. And so that's what I practice now. I practice concierge medicine, and I incorporate lifestyle medicine with internal medicine, because for me, my true love is internal medicine and the science behind it. And I try to get a lifestyle medicine, because I feel lifestyle medicine is like the foundation, and it's also important at every stage in your life, right? So if you have a patient where you can treat with nothing but lifestyle changes and they're receptive to it, you go with that. If they are not receptive to it and they want to just hear a little bit about it, you still use medicines, and you still kind of float the idea of lifestyle until they are ready, and then you keep adding it at different stages, right? So it's at foundation in every stage. So initially, when I started practicing, I was taking insurance, and I did group visits. I had a lifestyle coach. I had food for life classes in my practice that patients paid for out of pocket. And then I ran the CHIP program, which is the Complete Health Improvement Program, which is an intensive lifestyle intervention program, which has 18 sessions. So all of these things I did through insurance before, right? And they paid separately out of pocket for things like Food for Life or for the CHIP program. But I learned through all this process. So one of my friends, I'm very fortunate that way. I have a friend who is a wellness economist. So she advises a lot of spas and wellness industry. And then she told me that it's best to do the programs. Don't create your own. Just kind of run the programs. Run them a bunch of times, run different programs, so you'll understand what you like, what your style is. So I've done that. So I did that through using insurance. And so I did a bunch of group visits, and each group visit I had about 40 patients. So we would divide them up into 20 each. And then I did the lecture aspect, and then my lifestyle coach did the cooking aspect, so in different parts of our building. And then we would interchange. So the whole thing would last about 3 hours, start to finish, but we would see 40 patients, So I'm happy to go over all of this, with insurance. So you can bill for this. And then, but then I was at a crossroad where I had to either add on, more practitioners and grow my practice if I wanted to continue with the insurance model, or kind of back off. And I did not want to grow, in terms of becoming a manager. I really wanted to go deeper into understanding medicine. I spend a lot of time learning. I just finished, I'm also working on the wellness coaches, Shirisha. So I have to, while you were talking about it, I was trying to see, oh my gosh, I need to go and check my attendance and see, what are my next steps, because I finished module 1, 2, and 3. And then I also did the chef coaching from Harvard, the course that was also pretty nice. And then I'm also doing a professional plant-based lifestyle coach. Professional plant-based coach course. Just that's for myself, So it's so these are, I have other interests, and so I wanted to kind of decrease the practice a little bit. And so that's when I went concierge. I still work very hard. I still don't have any time, but now with the concierge model, it allows me time to really utilize coaching when I'm seeing my patients. And so this year I have just November, another physician in the area also got certified in lifestyle medicine. So we are in the same office practicing together. And I think, and her interests are exactly the same as mine. So I think we will, build on that. We'll keep building on that. So I'm happy to go deeper. I just don't want to take too much time. Thanks
so
Anita.
much, Dr. Aruna. Yeah, it was really helpful. Yeah, we'll do, I think, short once in a while, different topics. So it will help everyone. And
Thank you so much, Dr. Aruna. It's amazing what you shared. Really. Thank you.
Thank you. You guys are my inspirations.
Oh,
So.
no.
Come on.
Is there anyone? I think Shilpi was there. I don't know if she left. Is there anyone who gave exams and who wants to hop in? I don't see anyone. Do you see anyone, Geeta? Yeah. So go ahead. You guys can ask us questions. So, question you have?
Hello. Can you hear me? Hello, can you all hear me?
Yeah, namaste. Yeah, we know your mother is dead.
Yeah, I'm glad you can hear me. See, I'm a board certified anesthesiologist. Of course, I'm only practicing part-time right now. I just want to quit my practice in a couple of months. And, actually kudos to my daughter. She's really, put a little bit pressure on me to learn about this. I'm finding this as a very exciting opportunity because I don't need any personal income because I want to do, as it is, I do charity work once in a week. Even though I'm an anesthesiologist, I treat patients with diabetes or mild CHF, hypertension, or thyroid issues. And, I just prescribe medications because I'm not that familiar with how to change their diet. And also the one thing I noticed is if you try to tell them, totally 100% from, they don't want to, they will be very resistant. And what I noticed it is if you take it like baby steps, one day you change this, but that way they will be more compliant to your advice than rather than, hey, this is not good. You can't eat, meat anymore, everything plant-based, they might resist to it. But if you say slowly, you can incorporate plant-based food into your diet, then cut down on the other things or cutting down on salt or whatever. That's what I find. So I want to get more involved into this, and I want to also take the exam, not because I want to make any revenue out of this. I'm not at all interested. I want to help people because of my daughter, because she's giving me such an inspiration to me. So I want to, as it is, we do free service every week, treating patients with medical issues. So I want to do this and incorporate this lifestyle medicine into them and teach. See, mainly I treat patients of Asian origin, like Indian patients, Bangladeshis, and Pakistanis, and Middle East patients, and Myanmar, Burma, and so I want to help them in any way I can, because I thought I got so much from the United States. So I thought it's my time to give my time and effort to the people at free of cost, because
Thank you.
I got so much. I want to do something.
Thank you, Dr. Rao. Yeah, you're really inspirational. Thank you, Dr. Rao. Yeah, exactly. Like I want to share. Same thing, like, well, just like your daughter, like I also am like vegan, and I would say the same thing. Stop, having everything. Let me see. I'm not being. But that's what we learned in lifestyle medicine exam. That we were all laughing, and I changed what I tell my patients too. So we just say now limit cheese to that's a board question. 2 times a week. Instead of telling cut out all cheese, we say limit cheese 2 times a week. Limit chicken to once a week. So that's exactly we learned, and that's how coaching is. That's why I said like people get scared about plant-based, but what you add is what important, not what we remove. So we hardly have any negative prescriptions, we call them. If you say give up meat, that's a negative prescription. We always need to give positive prescriptions and we can build up on it. Yeah, definitely. I mean, you are in a perfect place, and your daughter brought you here, and this is how you can actually help. This is the like for me, I was the same thing. I was going on giving medications, but I didn't like to. I mean, prescribe medications, and I wanted to retire at 50. I turned 50 this year. I wanted to retire, but then now I don't think I want to retire once I got
Very
lifestyle.
good.
You're enjoying.
Yeah, even I will
Anita
not
is,
give it. Yeah,
Anita, you're stuck with lifestyle
I
medicine.
know. Yeah, so yeah.
And I want to say kudos to Madhuri for inspiring your dad and Dr. Paidisati. It's amazing what you want to do to give back to the community. What a great thought. Thank you.
Hi, everyone.
Yes,
I'm Madhuri's mother, and
My
now,
wife.
now their life is in my hands because I am the main cook in the house. They get it inside. So my daughter alerted me, Mom, Dad's health is in your hands. You better take the chance. You take this challenge. Your mom's and your husband's health is in your hands.
No.
So my mom is 80. She had a last year severe stroke. Now with the physiotherapy I'm giving at home, and with the right nutrition and food, she's improving a lot.
Definitely. We show our love with food and with all this stuff like, oh, add more butter or more sweets. But we have to show our love by giving healthy food. So that's what I try to tell the family. So that's why this lifestyle is like, I mean, we hear stories every single day. I think the other day on Thanksgiving, I think Sirisha got from her friend, someone. Her husband was in the class and she was just listening. And Sirisha, maybe you should share.
I know it was the perfect Thanksgiving gift. Like she calls me up. They live in Dubai, and we did an 8-week weight loss as well as diabetes reversal class. And she didn't join the class. Her husband joined. Her husband is an emergency medicine physician, and then she started implementing what we were teaching in the class, and she lost 17 kilos.
Oh my.
17 pounds, but 17 kilos. And she's like, she calls me up with so much happiness. And I'm like, you're set for life, you know?
No, more than that, what did she say? Like she feels fear.
Yeah. She said, when we started the class, she was like, they're saying oil-free cooking. How can we do that? But once she started oil-free cooking, it's easy for her. It may not be completely oil-free. Even if you reduce the oil, it shows effect. And for her, it helped to improve her confidence. She said she's never been so confident.
Nice.
Very good point, Sirisha.
That's the first thing we notice from people once they start. Everyone wants to go on board. Like my husband, I mean, he reversed, so he thinks he's an expert. I mean, he is actually. He wants to start a retreat in Hyderabad, like a health retreat. So he went there and he started. I mean, he did some preparation, went there, but everyone said, don't do it right now because of the COVID. No one will come. You don't want to take a risk. So every person, like the patients who are involved, they want to help other people. I mean, that's so happy. That's why I'm doing this. Like people ask, where do you have time? Because I just feel happy. I mean, we can't just keep this with us. We need to spread to so many people, as many people as possible.
I just wanted to share.
Yeah, go ahead.
One more thing, so growing up, my kids have always been around me when I used to round in the hospitals, and then they would hear me giving, so they would just recite things like CBC, CMP, lipid, the orders that we give, and then Lipitor 10 milligrams, aspirin 81. And so now, because they see me doing the Zoom meetings with the patients, and with, we do the Zoom meetings, they say like, oh, you know what mom says now, eat your greens, 1 cup of lentil every day, 3 vegetables. So that's so they actually, talk about what we used to, when they were young, that's what they used to hear. And now that they're older, this is what I tell my patients. So they still recite the same thing, but it's completely different from what they heard when they were growing up.
Isn't that amazing? Isn't that what we need to do? Food is medicine, right?
Yeah. So in my clinic, I even cleared my prescription. We used to get medical samples, right, from pharmacy reps. So I cleared all that, and I have, basically filled it up with a lot of because, I had a kitchen in my clinic, right? Before COVID, we used to have, we did cooking in my clinic. So when they walk into the clinic, it's like walking in to kind of a house, with a kitchen and all that. And so we made it a pantry. So we got rid of the drugs and we filled it with food.
Oh,
nice.
wow, very nice.
I would like to add something. I have found that unlike medicines we give in the Western world, something for cholesterol, something for diabetes, you will find that once people practice these lifestyle changes, this applies to everything. Your cholesterol, blood pressure, diabetes
Yes.
are all interconnected. So the foods
Yes.
you eat will affect and improve all these things, your pain levels, your sleep, your mood. I won't say that people will overnight stop medications, but if they consistently practice, then this is something they will see significant improvement. They will cut back on the medications, and they'll be able to continue this for the rest of their lives. And it's much easier than taking 4 medications, 5 side effects, more medications for side effects, more expenses. So in the long run, I think it's really much more meaningful to practice lifestyle medications, as in prescriptions of lifestyle, which is sleep, food, stress management, than continue indefinitely Western medications, which generally will keep building up, if you don't practice lifestyle side by side. So I think that is another of the good reasons why lifestyle will be an added benefit in your practice, no matter where you are, and of course, for your family and personal life.
Very well said, Geeta. That's absolutely true. Yeah.
I know it's late for people in India, so if you have to leave, it's okay. But we just love to talk. So please, if anyone has questions, please go ahead and ask.
Thank you so much, Anita.
Thank
So
you
I
for
will,
staying so
I'll be
late.
there
I
for
know.
any kind of help. I'm also inspired a lot by your selfless service.
Oh.
Like she has given me so many materials even before I started registering for the exam. So I will be there for any kind of exam or those related things, or even somebody wants to discuss about the business models, or the practice models. All these things, I will always be there.
Also,
We can.
you said you guys can coach also for people in India, right? Like
Sure.
give
We can do
exams,
that
even
also.
we'll add also. We can
Yeah.
also join in.
Sure.
So when the exam gets closer, like we can do the coaching.
Sure. We can do that actually. Definitely will be there. Okay then. Thank you, Sirisha, Geeta, ma'am, Geeta, doctor. Bye. Aruna, all of them I
Bye.
know.
Yeah,
And
it's so important. We give importance to sleep, so that's why we
Yes.
yeah.
yeah,
I'd
and
just like to
same
add, make
here.
local
You can.
support groups. You will find it very helpful, because what is practical in your local country, local state, both for practice and sharing knowledge, and support groups and networking has been very useful for us here when we studied for exams and for practice. So do the same, find people with similar interests and who are getting ready to give exams, and then you can bounce off ideas, questions, and experience off of each other. That really helps. All the best. Thank you.
I think Madhuri wanted to say something.
Thank you so much for all
Thank
the
you.
insightful information and guidance. Very helpful.
Thank you for all you do for the animals, Madhuri.
That's the most divine thing, Madhuri.
Anyone else has any questions?
I just wanted to say that
For well
if anyone
coaches,
wants
how
to
long
reach
does it
out,
take to get certified for well coaches? Like how long does it take, like generally, the health coaching?
Depending on, see Madhuri, depending on the time, how much time you're able to dedicate to the program, you can do. It's kind of self-paced. And 6 months is the ideal time, I would say. You want to add anything, Dr. Aruna?
No, I think that it's right. You have to either join the 18-week course. That means it's one program, one one session a week, or they even have an accelerated course where you can do 2 sessions a week, so you can finish that in 9 weeks. That is your 1, 2, and 3 module. Then your 4th module, and then the longest one is the last module. So I think, like Shirisha said, 6 months is a good allocation of time. I just wanted to, I'm going to jump off, but I wanted to just say that if anybody wants to reach out to me, Anita, please feel free to share. I can put my email address also. And if you are, I would, if there's any questions about using lifestyle medicine in practice, please feel free to reach out.
Yeah.
And,
Thank you so much for joining us.
no, thank you.
Thank you.
Thank you all.
Thank you.
Thank you all. Thank you.
You're welcome.
Thank you. Thank you.
Thanks. Bye.